Good day, dear students. In this video I will show you how to find blueprints, how to use blueprints, how to find blueprints for exams in the format of OSCE, Mini-CX, DOPS and OSCE. First of all, you need to authorize in the system. You enter your passport number and your password. Then when you log in at the main page, you will see timetable of your classes. Here you can see the time of the class, also the topic name, which will be held on this time, and the name of the teacher. So if you want to revise what questions are asked on this topic, you just need to press on the topic name right here. You need to wait for a while, then the blueprint is loaded. Here you can see table of specification, also is called blueprint. In this blueprint, in the first column is written topic name. At the end of this topic, letters, which mean code. To know what does this code mean, you must open catalog of competency, and inside of it you can find the meaning of each code. For bronchial asthma, there are codes E, F, D and P. Code E means that you need to put an emergency diagnosis and also treat this emergency situation. So the explanation of this code is written in the second column, which is called competency list. So here is written that you must put an emergency diagnosis for bronchial asthma. Then scrolling down, and here we can find that you need to make an emergency treatment. Also, the other codes will be written after the previous one. So to do this high competency, to put emergency diagnosis for bronchial asthma, you must do several steps that are written in the sub-competency. I want to say that checklists on some problems and some clinical skills are written in this third column. So these steps determines emergency findings, makes emergency laboratory evaluation. These are all steps from the checklist. So when you will have exam in OSCE, DOPS, so you must do examination of patient in right this way, step by step, as written in the third column. So you have to know something about determination of emergency symptoms, and these knowledges and skills are written in the fourth column. For example, you must list life-threatening symptoms. You also need to explain the mechanisms of life-threatening symptoms. You must care about determination of life-threatening symptoms. You also have to describe features of life-threatening symptoms, and you should define symptoms in this case. So if you know all of these steps, you can easily determine emergency symptoms. You can pass this step. So if you learn all the blueprint, you will be able to answer to any question from any examination, like OSCE, OSCE, DOPS and mini-clinical evaluation. So now I want to show you some scenario, just for example, which are used on OSCE or OSCE examination, just to show you a difference between scenario and checklist. Now I will show brief on scenario on sexually transmitted infections. At the beginning, when you will enter the OSCE examination, you will have some instructions that you must do with your patient. For example, in this case, you must demonstrate your communicative skills. Then you must ask about complaints and also anamnesis of standardized patient. Then you must open the file of physical examination of the patient. If you have troubles with computer or with internet, you may also have these files in the paper base. So when you have this file, you must look, check and explain the pathologic signs and pathologic conditions which you found in this file to your patient. In the next part of this OSCE, there are several steps that are written for the teacher to assess your answer. So you must do these steps to get some points and increase your mark during your examination. The first step in this OSCE is to greet the patient, introduce yourself, clarify the surname and name of the patient. If you do this step, you will get 2 points. If you not, you will get 0. You must also take verbal or written consent for examination. The next step is, during the conversation, you must repeatedly refer to the patient by his name. All these steps are basic and used in every examination of the patient, and you can know these steps from the discipline which is called communicative skills. So there are a lot of parts of this OSCE. One of them is physical examination. For example, in our case, there is a step where you must describe changes that you can find on the skin of this patient. So you must open the file, or if there is no file and you have standardized patient, you must examine this patient. You must check the skin of his head for some rash and etc. and you must give explanation of your finding. If you do this, you will get 10 points. If you not, you will get 0. So you can see that there is no something new, and everything that is asked in the OSCE scenario is also written in your blueprints. So if you learn topic completely, you will be able to answer to any question. So for example, if you have a blueprint which has code D, that means diagnosis, you must learn everything about diagnosis, all fourth column where you can find aims and some questions about diagnosis, and you will be able to get highest point. So it was the video about OSCE and checklist. Goodbye.